Hello everyone, welcome to Little Growing Bones. My name is Judith Nasazi. I'm a children's bone doctor. Here on YouTube we talk about pediatric orthopedic pathology and how to fix it. So today we're going to talk about an interesting and common question, which is prepping your child for pediatric orthopedic surgery. Yes, this is a very common question. It can be a very challenging time, but if you use the right approach, a great strategy, you can have a very smooth ride through this time for both you and your child. So let's get into it. So first things first, you need to have a very clear understanding of the surgery your child is going to have. Your pediatric orthopedic surgeon is the best resource for this, okay? So endeavor to ask as many questions as you have. Write down the questions that you have. Anytime your child asks a question related to this, write it down. So when you come in to see the surgeon, you have all these listed out, and you can quickly ask them and get the right answers. Take as much time to do your research. Ask from friends and family or people who have actually experienced this, and ask your doctor to write down the name of the procedure that is going to be done, because these names can sound complicated sometimes, and so you can go and read about it. Okay, if you have more questions pertaining to this and this feels overwhelming, just we do offer private appointments, so you can set up private review with us and we can go over this with you. Okay, I've also created a checklist. You can find it here with the commonly asked questions pertaining to preparing for surgery, and let me know if you find that helpful. I'll link it in the description below. Okay, so moving on, communication is key. Okay, take the time to talk openly about this with your child. Talk about the upcoming surgery. Use age-appropriate language so that they're not overwhelmed or left confused by what you're trying to talk about. Encourage them to ask questions and make a habit, as I mentioned earlier, of noting the questions that they ask, so that when you go in, you can you have somewhere to read from and already formed out questions. So and so you don't forget anything. So reassure them that this will be okay, that it's okay for them to be scared. Surgery is scary for whether it's an adult or a child. So reassure them that this is going to be okay, and it's just a step away from them getting better. Okay, and lately very many hospitals will allow you to take a trip around the hospital, to go around and see the staff, and even visit the theater, so you can sort of know what to expect. Okay, and also very many hospitals will let the parent in with the child before the surgery starts, so that they have a more familiar person around them, and that can help ease their anxiety, and the parent is the first thing when the child wakes up. Okay, so familiarize yourself with the place where the surgery is going to happen. So familiarize yourself with the hospital environment, and many hospitals are happy to to give you someone to take you around, so you can know where you're going to be staying for the time period as the child is having the surgery. Okay, so the surgery is done. Now what next? So after the surgery, it's very important for your child to have a comfortable place to recover from. So make it cozy in the place that you want them to have their recovery. Set up a comfortable room with their great toys and other things that they love to do, so they can have a great recovery. Make sure that you stay organized. So there are very many things that are going to happen after the surgery, like they're going to be on medication, they're going to require follow-up reviews, they might require physiotherapy. So make sure that you're taking note of the dates for all these respective things, and you're having a great schedule so that you don't miss out on anything. Okay, remember that every child is unique, and there's no one size fits all when it comes to pediatric orthopedic surgery. So having the right information about the surgery is key. Communicate openly with your child. and create a supportive environment for them to feel well taken care of, okay? And that can help ease their anxiety and your anxiety as well, okay? If you found this video helpful, please go ahead and give us a like and subscribe to the channel as well, and share it with other parents or other people who might find it helpful. And until next time, keep it on Little Growing Bones. Bye.